I'm on a lot of electrologist forums and social media platforms, and I'm regularly seeing comments by new electrologists who've just graduated school where the schools didn't teach them about consultations, or I'm seeing posts from people who have just started electrolysis and they didn't receive a consultation, and they're asking, is this normal, and posting pictures about their skin from after their treatment, or they're asking questions about aftercare. These are all things that should be covered during a consultation. So with my consultation, when a client first reaches out to me to book an appointment, it doesn't matter if they've had electrolysis before or not. It is mandatory in my clinic that every new client has a consultation. Now I give my own back history of the reason why. When I first started my journey in electrolysis as a client, I think I had maybe a 10-minute consultation. It really didn't cover anything. I didn't leave knowing that I needed to have regular appointments close together for my treatments to be really effective and for me to shorten down my treatment time. And so because I didn't book my appointments close enough, it took a really long time for my electrolysis journey to be successful. During my electrolysis journey, because I moved several times, I've had 5 electrologists. And I don't know if it's because they just assumed that my first electrologist had told me everything I needed to know, or if they just didn't do consultations. Either way, nobody ever talked to me again about having a consultation. And so when I became an electrologist and I learned about the consultation, I decided to make it mandatory. Even if you've had electrolysis before, you're getting a consultation, because I don't know what you know, and I need to know that you know what I know so that you are successful with your electrolysis journey. Your consultation starts before we even step foot in my clinic. The client treatment form. When my clients reach out to me for an appointment, they get a link sending them to this. So the beginning of the form is typical. It is your name, it's your phone number, it's your email address, and how did you find out about us, okay? Then we go into the medical information. So the medical information is really important because it helps us determine the type of hair growth that we're looking at. The first section is hormone questions. This helps us determine if it is hormonal hair that we are dealing with. The next part of the questionnaire are general health questions. So these are questions about any medical conditions that you may have. So if you have a medical condition, it doesn't mean that you can't get electrolysis. There are some that no, we cannot perform electrolysis if you have them. There are other conditions that maybe we just have to take some extra precautions. Maybe you need a doctor's note. If you get cold sores or herpes, and we're working in an area where those sores appear, it's important that you take your antivirals before your appointment because it may trigger a flare-up. A lot of people skim over that question on the questionnaire because there's a shame stigma attached to it, especially for the herpes portion. There's no need to be ashamed of it. It is a virus and just needs to be respected as such. So if you get cold sores, if you have herpes outbreaks, make sure you take your antivirals before your session. Or if you use a cream, have the cream ready in case you have an outbreak. We also ask questions about medications and supplements. There are some medications that if you're taking, we cannot perform electrolysis on you. Or you may have to wait 6 months after you finished your prescription before we can treat you. There are medications that can stimulate hair growth. Same with supplements. So this is why we ask those types of questions. Then, do you have any of the following? And it's talking about body piercings and dental implants because sometimes that can affect your treatment. Not that you can't have it, just the type of treatment you can have. All right. Also, have you ever had Botox, dermal fillers, chemical peels, laser resurfacing? If you indicate any of those, it doesn't mean that you can't have a treatment. It just means that we may have to delay your treatment. Then general skincare questions. It's important for me to know what type of skincare routine you have right now. For people who may not have a skincare routine, like me, it's very important that they understand how important it is during electrolysis to follow the aftercare information. Previous hair removal methods impacts our treatment plan, okay? So we know that if you've been waxing for 20 years, 10 years, 5 years, your follicles may be deeper. You may have distorted follicles. If you've been getting laser, your hairs may be finer. And so this is information that we use to create your treatment plan. Then we get into what have your previous reactions been with hair removal? Did you get bumps? Did you get ingrowns? Did you get redness? Did you get swelling? Just gives us an idea of what's going on with your skin. Then the areas to be treated. Of course, we need to know that. Now, just because you check it off doesn't mean you're committed to it. Or vice versa. If you don't check it off, doesn't mean we can't talk about it at a later date. It just gives us an idea of what we're starting with, okay? And then we have acknowledgement of information. So this is where the standard waivers are, as well as, even though I've already previously sent my client a link to my late arrival, late cancellation policy, it is on here again. So they read it again and they have to sign off. I also ask for permission to take pictures of the client of where we're working. Now, these pictures are not used for social media. These pictures are progress pictures only. So when my client first comes in, I take a picture of the area that we're working on, and then as we progress with their treatments, if they ever want to go back and look to see how things were when they started as a comparison to where they are now, then we have that history. Progress photos are an integral part of your consultation. It's important that on your client intake form, you have a check box that indicates that you have the client's permission to take the photos. And most of our clients do not want their photos used for social media. So it's important that you are very clear that these are for clinician work only, and it is only to mark their progress, and do not break that trust. If you say you're not going to use them for social media, don't use them for social media. If you want to use them for social media, then you need to get your client's permission. These photos are used to document their treatment. So when they first come in, that's usually when the hair is the most dense, and it shows any imperfections they may have on their skin, like moles, angiomas, any like maybe dark freckles, pigmentation, any pitting, any scarring. That's important to document for your client as well. And the reason we use these is so that in the future, if they have any concerns and they say, oh, I'm noticing I've got a scar, we can go back and look and say, oh, you had that before. Hyperpigmentation, so freckles. Oh, that mark was there before, or it wasn't. We may need to adjust our settings, okay? So it's important to document the photos. It's also important so that as they're going through their journey, if they get frustrated and they're feeling that they're not seeing progress, you can go back and look to see if progress has been made, and you can compare a before photo to a now photo. Now, you may want to do these photos monthly. You may want to do them every 3 months. You may want to do them every 6 months. That's up to you, but you do want to document their progress. If you're a client, you want to document your progress as well. Now, remember to take very clear photos, because when you first start, it'll probably be a lot more apparent because of the density of the hair growth that you're dealing with than, say, 6 months down the road, where you feel like you're waking up like a hairy beast, and then you take the photo and you have to really zoom in to see where the hair is. So remember to take the photos. That is the health questionnaire. On that note, when my clients come in, I also have them sign in each and every time on their own personal sign-in sheet that is attached to their file. This sign-in sheet asks them, have there been any medical or health changes since your last visit? So what this is referring to is, have they been diagnosed with anything? Epilepsy, MS? Have they gotten pregnant? Have they had an IUD inserted or removed? Have they started different hormones? Have they started new supplements? Anything like that. We're not talking about a common cold, okay? But it's really important that you track these things, because even something like vitamin D can stimulate hair growth. So if suddenly they start seeing more hair growth and they're asking, oh, Why isn't electrolysis working? We can go back to their sign-in sheet. We can see where there have been changes. We can discuss how that may be impacting their hair growth. This is important that you keep this kind of a record for every time your client comes into your clinic. There are 3 different types of electrolysis. Electrolysis is the blanket term for what we do. The different methods of electrolysis, there's galvanic, there's thermolysis, and there's blend. No one method is better than the other. It depends on the skill of the electrologist. In my office, I primarily use thermolysis. I take a sterile disposable probe that's only ever been used on you. I insert it into the follicle. The follicle is a natural opening in your skin already. I'm not creating a new hole. I insert the probe into the follicle down to the lower 2/3 of the follicle. That's where the bulb, the bulge, and the papilla are located, and those are the cells that are responsible for hair growth, and they are my target. You'll feel a heat, a tingle, an itch, or a sting, depending on how your body perceives the sensation. I withdraw my probe, and then I take my tweezers and I grab the hair and I slide it out, and we move on to the next follicle. There are 3 stages to hair growth. Now, I can kill a follicle or destroy a follicle, however you want to say it, in any stage of hair growth. But the most effective time for me is in the anagen stage. In the anagen stage, the bulb is attached to the papilla. The papilla is attached to the capillaries. The capillaries carry the blood carries the hormones and the water. This is the active growth stage. So when I go into the follicle, the bulb is here, the papilla is right here, and the bulge is right here. I have a very high success rate of getting all of the cells responsible for hair growth in the anagen stage. As the hair grows, the follicle grows deeper. So as you can see here, the follicle grows here. Depending on your ethnicity or your previous methods of hair removal, a follicle can distort. So when I'm using thermolysis and that follicle is distorted, if I'm going here and I'm delivering the pulse here, the bulb and the papilla are over here, and so I'm not actually treating those. So when I go to remove that hair, if I go to remove the hair and there's resistance, then I will go back in and try that follicle again. If after the second time I've done this, if it doesn't slide out the second time, then I'm going to assume that that follicle is distorted, and I'm just going to pull the hair and it's going to hurt like a tweeze. When that follicle grows another hair, I can get it the next time around. Now, depending on how distorted the follicle is, sometimes it can take 3 or 4 hair cycles for that follicle to straighten out enough for us to treat it. The next stage of hair growth is the catagen stage, and that is where the bulb is starting to pull away from the papilla. So imagine a child's balloon, and you're getting ready to blow it up. So you stretch it all out. You go to blow up the balloon, but the neck is stretched out. So it's getting some air, but it's not getting a lot of air, right? That is what's going on with the catagen stage hair. That bulb is starting to pull away from the papilla, so it's not getting as many nutrients or as much water. Because the follicle has been growing deeper, it also spreads the cells out that are responsible for hair growth. So the follicle is here, the papilla is here, that bulb is starting to pull away here. The bulge is going to be higher up here. So if I don't get all of those cells responsible for hair growth in the catagen stage, then I will just have to treat it when it starts growing another hair. Because we are making our insertions inside a follicle, we're working blind. There is no way for us to be certain that we can get every single cell responsible for hair growth. They're not in there holding up a little sign going, pick me, pick me. In the telogen stage, the bulb has completely separated from the papilla. So it is getting zero nutrition. It's dehydrated, it's desiccated, it's like a grain of salt on the end of your hair. In the anagen and catagen stage, if I go to remove a hair that hasn't been effectively treated, it's going to hurt like a tweeze. In the telogen stage, if I go to remove a hair, it's going to feel like a tug. That's the difference. I will know when I see the end of that hair if it's in telogen stage, because I will be able to see the white bulb. You won't be able to tell the difference. Either way, because that bulb has pulled away completely from the papilla, there may be another hair already growing down here, a little bulb growing down here with the papilla. If this bulb is in the way and I can't get down to there to give that pulse of energy, then I don't disable this follicle. So I can disable the bulge. This bulb is already dead. This follicle, the capillary here and the papilla, if I can't reach them, this follicle will grow another hair, and I'll just have to get it when it's back in the anagen stage. Electrolysis is a progressive treatment because we need to get all of the cells responsible for hair growth in every follicle. So you have to have a bit of patience. This is not a treatment that you just come in and it's done, one and done. Once we have killed all of those cells responsible for hair growth in that follicle, it is disabled. It is basically scar tissue inside of that follicle, so it can never grow another hair again. There are 3 phases to electrolysis in regards to your treatment schedule. The first phase is the clearing phase, okay? The second phase is the control phase. The third phase is the maintenance/finishing phase. So when you first start coming in, that is the clearing phase. Your appointments are closer together and they're longer. As time progresses, your appointments start getting shorter and shorter. Then we bump you out to every 2 to 3 weeks. That's the control phase. Then you start coming, your appointments are longer in the beginning, and then the appointments start getting shorter, okay? Then we graduate to the maintenance phase or finishing phase. Now this is just where we're getting those last few hairs that are in their own little cycle. And eventually you get to quit coming because we have no more hair to work on. Okay, so those are the 3 phases of electrolysis. If you put your finger to your chin, in that square inch, you've got between 500 and 1,500 follicles. They're not all actively growing hair, but they can be activated by your body at any time to grow hair. As electrologists, we can only treat those follicles that are actively growing hair. And what can happen is, as we go through different hormonal cycles, new follicles will grow hair. So that's why when you read these stories about, oh, I had electrolysis in my 20s and now I'm in my 50s and I'm having to get it redone. That's not because electrolysis didn't work. All of the follicles that were treated with electrolysis will never grow hair again. As we go through hormonal fluctuations, follicles that were never growing hair before start growing hair. So when you have conditions like PMOS, which is what PCOS used to be called, NCAH, perimenopause, menopause, pregnancy, puberty, those are all hormonal fluctuations that can stimulate follicles to grow hair. How can you prepare for your electrolysis session so that I can work efficiently and effectively and it's the most comfortable for you? When you're getting ready for your appointment and you're concerned about how long to grow your hair out, all I need is for your hair to be just long enough to grab with a pair of tweezers, no longer. That is about that length there. The little silver nub above the gold there, that's about all I need. A little short grain piece of rice. Anything longer than that, it starts to, depending on the density of your hair, it can get to be like, what are those mazes that you have to work in? Yeah, we don't want that. I do not need you looking like a backwoods tree logger with the big bushy hair. Just grow it long enough for me to grab with a pair of tweezers. I need you to drink lots of water. So most of us are chronically dehydrated. I tell my clients 100 ounces of water the day before, 100 ounces of water the day of, 100 ounces of water the day after. So that's 4 of these Contigo bottles. Electricity loves water. The more water you drink, the more comfortable the treatment will be. So in addition to drinking water, because again, most of us are chronically dehydrated, I also tell my clients to add electrolytes to their water. Now, it doesn't have to be the expensive electrolytes. You can go grab some Himalayan salt, some sea salt, some Celtic salt, and just put enough salt in the water that the water feels silky in your mouth. You don't need to taste the salt. It just needs to feel silky. The reason we drink it the day before is to hydrate our follicles. When you are fully hydrated, your follicle walls are nice and firm, and it makes the insertions easier for me, and I can work faster. Plus, when electricity loves water, and when you have a follicle full of water, when my probe touches the water, it's like a big steam bath in there, and that releases the bulb. Plus, it dissipates the energy, so it's more comfortable for you. Imagine you have a shirt that you're ironing. You have the iron on, but you have it on the dry setting, and you're running that iron over that crease over and over, and it's not going anywhere. But you hit the steam button, and it releases all the fibers, right? That's exactly what's going on inside your follicle. It releases the bulb. So the more hydrated you are, the more efficient and effective the treatment is, the faster I can work. So 100 ounces of water the day before. The day of your session, drink another 100 ounces of water, and the day after. The more water you drink, the faster the redness and the localized swelling and the side effects dissipate, the faster your skin heals. Avoid all caffeine the day of your appointment, before your appointment. Caffeine is a diuretic. So if you're drinking caffeine before your appointment, you're going to pee out all the good water that you drank, all right? Caffeine is a stimulant. So caffeine will stimulate your nerves. If you have caffeine before your appointment, you may feel the appointment more because it ramps up your nerves. So where can we find caffeine? Okay, I go through this list because some people are surprised. Obviously, coffee and tea, green tea, matcha tea, decaffeinated tea, decaffeinated coffee, energy drinks, any fat burners that have caffeine in them. Look at your labels. You might be surprised. Pre-workouts, dark chocolate, Mountain Dew, and all your dark pops. Those all have caffeine in them. So just avoid them before your appointment. Have as much as you want after your appointment, okay? If you have drinks the night before, you want to avoid alcohol the night before, because alcohol is also a diuretic. So if you're going out with your friends the night before and you're planning on having some drinks, keep in mind your electrolysis appointment the next day might be feeling more spicy if you're dehydrated, okay? Sun dries out our skin, so make sure when you go outside, you've got sunblock on. It doesn't matter if your skin is tanned. We're not laser. Laser, you can't have tan skin or dark skin. Electrolysis doesn't use a light that melanin attracts it. We use electricity. So it doesn't matter how dark your skin is, but what matters is how moist your skin is. So make sure you use moisturizer and you use sunblock. Exfoliating is also very important. As we go throughout the day, our skin is just naturally sloughing off dead skin cells all day long. You combine that with the natural oils in our skin, any products you use on your skin, the fibers from our clothes as we take our clothes on and off, our dirty, grubby hands as we're touching our face or our skin wherever we're having our treatments, plus the dust and debris in the environment, and it creates a cement inside your follicles. And so if I'm going into your follicle and it's all plugged up with debris, I'm having to use more pulses to get into that follicle, which is, more uncomfortable for you. It slows me down, so it costs you more money. So make sure you exfoliate. I always tell my clients to exfoliate at least 3 times a week. 4 times would be best. If your skin is too sensitive, then twice a week, but always before you come see me for your appointment. So if your appointment is at like 4 o'clock in the afternoon and you're getting ready at 6 o'clock in the morning, just exfoliate then, okay? If after your treatment though, do not exfoliate for 2 to 3 days, okay? Let your skin heal, okay? So again, the more moist and hydrated your skin is, the more comfortable the treatments are, the faster I can work, the more money you save down the road because your treatments are more efficient, okay? After electrolysis, your follicles are open for 2 to 3 days. So during that time, don't be touching the area with your dirty, grubby hands. We all know we have dirty, grubby hands, so just don't touch the area we've been worked on, okay? You're going to want to avoid using any makeup. If it's in an area where you would wear makeup, your makeup is contaminated. You don't want to use any harsh skincare products. So no alcohol-based products, no perfume-based products, no chemical exfoliants, all right? If you can imagine, there's a small sunburn inside your follicle, and if you put any of these irritants on the open follicles, it's going to cause them to be inflamed and it's going to take longer for them to heal, all right? So avoid all of those. Avoid anything that's going to make you sweat after your appointment. So if you want to work out before your appointment, make sure you do it before your appointment, but don't work out that day after your appointment. Make sure that if you're no saunas, nothing that's gonna, sweat carries your bacteria. So if you go out and you do any of these things that cause your body to sweat, you're gonna get pimples. Just like if you use contaminated makeup, you're gonna get pimples. So to avoid the pimples, avoid anything that's gonna make you sweat. Don't exfoliate for 2 to 3 days. You're gonna wanna use your aftercare. So in my clinic, I sell a product that's very similar to Nature's Aid. So in Canada, it's called Nature's Aid. It is witch hazel, rosemary, tea tree oil, aloe vera, and vitamin F. So the witch hazel, the rosemary, the tea tree oil are all antiseptics. The aloe vera is for natural healing. The vitamin F is for cell repair. Now, if you are using witch hazel and you notice that you are suddenly getting extremely itching, like you want to claw your face off, stop using witch hazel, because that means that you're having a reaction to it. You've got a sensitivity, so you'll have to find something else for cleaning. But make sure you do use something for healing as well. So I do not recommend polysporin. It's petroleum products in a tube. Yes, it's got antibacterials, but what happens is people buy their polysporin, they open up the tube, they take their dirty finger and they wipe the gunk off, and then they wipe it on their skin. It's now, that whole tube is contaminated. So I don't recommend any products like that. Avoid sun exposure. This is just because your skin is more sensitive to the sun after a treatment. So if you're going to be out in the sun, make sure you wear your sunblock. If not, the area that we worked on could get pigmented or burn from the sun just because it's more sensitive. So make sure you wear sunblock. A normal reaction afterwards is redness, localized swelling. You may get some histamine bumps. Those look like mosquito bumps. Usually those disappear after a few hours. When you first start electrolysis though, you may have a bigger reaction. That's because it's going, what the heck are you doing to me? So don't be surprised if you do. As you start having consistent electrolysis appointments, those side effects dissipate quickly. You may get some red bumps that look like pimples. They're not pimples, but they can take up to a week to go away. You may also get some pinpoint scabbing, really little itty bitty bitty ones, okay? Just don't pick them off. Let them fall off naturally, keep them moisturized. And because we are working with capillaries, sometimes if we pierce a capillary, we may cause a bruise, and it can last 7 to 10 days. It doesn't happen often, but it can happen. Ingrown hair, just don't tweeze it out. Leave that for your electrologist to remove. You can, if it is ingrown and really bothering you and you want to release it, you can release it, just don't remove it. If you're having like upper lip work done and chin work, that is the most common place that people touch with their hands and they don't realize. Not to mention, if you're constantly lifting dirty water bottles to your mouth, your coffee cup, you're eating food, all of that introduces bacteria to the area we worked on. So it's really important for you to keep that area clean. If you don't follow the aftercare, you're going to get pimples. If after 24 hours you're still noticing that your skin is irritated, you can use 1% hydrocortisone cream. It's really good for pimples, but it also helps reduce swelling and inflammation. Or if you're having a larger part of your body done and you have a bathtub and you can take an Epsom salt bath, that's really helpful. It's really soothing and it's good healing. Or you can, if you're having a smaller area done, just dissolve some Epsom salts in some warm water, not hot after a treatment, just warm, and then soak your cloth in it and then press it to the area. That also helps. It might sting you just like a little bit at the beginning, but then it feels really good after. If you have any reactions that are bigger than that, you need to discuss them with your electrologist. Your electrologist is not psychic. I can't stress this enough. It's important during your electrolysis journey that in between your electrolysis sessions, you do not remove the hair in any way, shape, or form other than shaving, cutting, trimming. If you use depilatory creams, if you're waxing, if you're threading, if you're plucking, tweezing, you are disrupting the hair growth cycle. No, once I tweeze, the hairs will be back in a few days. I know my hair growth cycle. No. Remember when I said, in that square inch, you've got between 500 and 1,500 follicles, okay? The ones that are actively growing hair. If you look and you're like, oh, I've got 5 hairs growing there, I'm just gonna pluck them. Tammy won't know the difference. You're right. When you come in for your session, I won't notice that they're gone. But what will happen is those hairs are gone for 6 to 8 weeks. No, they won't. They'll be back in 3 or 4 days. I know how my hair grows. No, the hairs that you're seeing in 3 to 4 days, in a week, in 2 weeks, in 3 weeks, those aren't the ones that you plucked. Those are all their friends. They're still coming up through the skin surface. Okay? So just like if you go get waxed, the wax technician rips the wax off and rips all the hair out, and you're thinking, oh, that feels so nice and smooth, right? And it does for a few days. And then a couple days later, 3 days later, you start feeling the stubble. And it's not that the waxing tech missed those hairs. Those hairs were not at the surface when you had your wax done. It's the same thing with electrolysis. So tweeze the hairs you want to keep. Otherwise, leave them for me to take care of with electrolysis. After I have a client for the first time in my chair, I always follow up with them with a text a couple of days after their appointment, asking them how their first treatment went, and if they have any questions or concerns, to reach out to me and text me. If after your treatment you have any concerns, communication is important. Make sure you take clear pictures so that the electrologist, when you bring your concerns to them, they can zoom in on the pictures to see what you're talking about. Or better yet, crop and enlarge and send it to them via text or email or messenger, however you talk with your electrologist. Make sure you keep them in the loop. It's all about communicating with your electrologist. Your electrologist uses settings appropriate for you. And if you have a bigger reaction, they need to know about it so that they can adjust their settings. If you go onto social media, and I'm just on a lot of different social media. I answer a lot of questions on social media, and I see a lot of people raising concerns about their treatments. But when I ask them, have you talked to your electrologist? They haven't. So it's really important that you talk to your electrologist. You need open lines of communication with them so that they know what's going on with your skin after a treatment. Okay, so that if they need to adjust the settings, they can adjust them or try a new program on you. Okay, so just keep that in mind. Each treatment cycle reduces hair, creating real progress over time. Consistent electrolysis creates progress you can see. Every electrologist does their consultation their way. There's no hard and fast rules as to how a consultation should be done. However, it's important that your medical history is covered, your medications, your supplements, because supplements can affect hair growth. To explain what electrolysis is, what your treatment schedule is going to look like, what to do to prepare for your treatment, what to expect during your treatment, and what to expect after your treatment. Those are just the basics of a consultation. Good luck on your journeys.